Malaria is a life-threatening disease caused by parasites of the Plasmodium species, transmitted to humans through the bites of infected female Anopheles mosquitoes. The history of malaria is a long and complex one, with evidence of the disease dating back thousands of years. Ancient texts from Egypt and China mention symptoms resembling those of malaria, and it has been a significant public health issue throughout history. The disease was once rampant in many parts of the world, particularly in tropical and subtropical regions, where conditions favored mosquito breeding. In the early 20th century, researchers discovered the connection between mosquitoes and malaria transmission, leading to significant advancements in the understanding of the disease's life cycle. This knowledge paved the way for effective prevention strategies, including the development of insecticides and anti-malarial drugs, transforming malaria control efforts. The Plasmodium parasites responsible for malaria are classified into several species, with Plasmodium falciparum being the most deadly. The life cycle of malaria is intricate, involving both the mosquito and the human host. When an infected mosquito bites a person, it injects sporozoites, which travel to the liver and mature into merozoites. These merozoites are then released back into the bloodstream, where they invade red blood cells, multiply, and cause the cells to rupture. This cycle results in the classic symptoms of malaria, including fever, chills, sweating, and headaches. Severe cases can lead to complications such as anemia, respiratory distress, and organ failure, making timely diagnosis and treatment crucial. The complexity of the life cycle and the ability of the parasite to develop resistance to treatments pose significant challenges to malaria eradication efforts. The symptoms of malaria can vary depending on the species of Plasmodium involved and the individual's immune response. In uncomplicated malaria, symptoms typically appear 10 to 15 days after being bitten by an infected mosquito. Initial symptoms may resemble those of flu or other viral illnesses, which can lead to delays in diagnosis and treatment. As the disease progresses, symptoms can become more severe, especially in vulnerable populations such as children, pregnant women, and individuals with weakened immune systems. Plasmodium falciparum infections, in particular, can rapidly progress to severe malaria, characterized by high fever, neurological symptoms, and multi-organ failure. Diagnosis usually involves blood tests to detect the presence of Plasmodium parasites, and rapid diagnostic tests, RDTs, have become increasingly available to facilitate timely treatment in remote areas. Early detection and appropriate treatment are essential to reducing mortality rates associated with malaria. Preventing malaria transmission involves a combination of strategies aimed at reducing mosquito bites and controlling mosquito populations. Insecticide-treated bed nets, ITNs, have proven to be one of the most effective methods for preventing malaria, especially in regions with high transmission rates. By providing a protective barrier during the night when mosquitoes are most active, ITNs significantly reduce the incidence of malaria among vulnerable populations. Additionally, indoor residual spraying, IRS, with insecticides is employed to kill adult mosquitoes resting on walls. Other preventive measures include the use of mosquito repellents, wearing long sleeves and pants, and eliminating standing water to reduce mosquito breeding sites. Public health campaigns focused on raising awareness about malaria prevention and the importance of seeking treatment also play a crucial role in controlling the disease. Efforts to combat malaria have seen significant advancements in recent years, but challenges remain. Global initiatives, such as the Rollback Malaria Partnership and the World Health Organization's Global Technical Strategy for Malaria 2016-2030, aim to reduce malaria cases and deaths significantly. Research into new vaccines, treatments, and vector control methods is ongoing, with promising candidates showing potential in clinical trials. The development of a malaria vaccine, such as RTS-S, represents a significant milestone in the fight against the disease, although its implementation faces logistical challenges. Furthermore, the emergence of drug-resistant Plasmodium strains has raised concerns, emphasizing the need for continued investment in research and innovation. As climate change and urbanization alter mosquito habitats and transmission dynamics, adaptive strategies are essential to address the evolving landscape of malaria. By combining effective prevention, timely treatment, and sustained research efforts, the goal of eradicating malaria remains within reach, offering hope for future generations. Malaria's impact on global health is profound, affecting millions of people worldwide, especially in sub-Saharan Africa, Southeast Asia, and parts of Latin America. According to the World Health Organization, WHO, there were approximately 241 million cases of malaria and around 627,000 deaths globally in 2020. The disease disproportionately affects children under 5, pregnant women, and individuals with compromised immune systems. Malaria not only poses a significant health burden but also has far-reaching economic implications. In endemic regions, the disease can hinder economic development by reducing productivity, increasing healthcare costs, and perpetuating cycles of poverty. Families affected by malaria often face substantial medical expenses, leading to financial strain and reduced investments in education and other critical areas. The economic burden of malaria extends beyond direct medical costs to include loss of productivity due to illness and mortality. In areas where malaria is endemic, frequent illness can result in significant absenteeism from work and school, affecting individuals' ability to earn a living and children's educational attainment. Studies have shown that malaria can contribute to a reduction in GDP growth in affected countries, with estimates suggesting that malaria could cost Africa alone billions of dollars annually in lost productivity. Governments and international organizations recognize the need to address this economic burden, and investments in malaria control programs can yield significant returns. Effective malaria prevention and treatment programs not only improve health outcomes but also enhance productivity and economic stability, creating a positive feedback loop that supports sustainable development. Research and innovation play a vital role in the ongoing fight against malaria. The development of rapid diagnostic tests, RDTs, has revolutionized malaria diagnosis, allowing for quick and accurate detection of the disease in remote and resource-limited settings. This innovation has improved patient outcomes by facilitating timely treatment, reducing mortality rates, and preventing the spread of the disease. Furthermore, advancements in treatment options, such as artemisinin-based combination therapies, ACT, have proven effective against resistant strains of Plasmodium falciparum. Continued investment in research is essential to stay ahead of emerging challenges, including drug resistance and changing mosquito populations. In addition to new medications, research into vaccine development has gained momentum, with several candidates currently undergoing trials. A successful malaria vaccine could significantly reduce transmission rates and offer a powerful tool for controlling the disease in endemic regions. Community engagement and education are crucial components of malaria prevention and control strategies. Local communities play a vital role in implementing preventive measures, as their involvement fosters a sense of ownership and responsibility toward malaria control efforts. Health education campaigns focused on the importance of using insecticide-treated bed nets, seeking timely medical care, and understanding malaria transmission can empower communities to take action. Training community health workers to diagnose and treat malaria at the grassroots level ensures that care reaches those most in need, particularly in remote areas with limited access to healthcare facilities. Additionally, collaboration with local leaders and organizations can enhance the effectiveness of malaria control programs, creating a unified approach that addresses the unique needs of each community. Building trust and promoting health literacy are key to sustaining long-term efforts against malaria. As the global community continues to tackle malaria, the importance of collaborative efforts cannot be overstated. Partnerships between governments, non-governmental organizations, and international agencies are essential for sharing resources, knowledge, and best practices. The Global Fund to Fight AIDS, Tuberculosis, and Malaria, for example, has mobilized substantial financial resources to support malaria control initiatives worldwide. International collaboration is crucial for monitoring and responding to malaria outbreaks, sharing data on drug resistance, and ensuring equitable access to prevention and treatment methods. Additionally, cross-border initiatives addressing malaria in regions with shared ecosystems can significantly impact transmission dynamics. By fostering a collaborative and multi-sectoral approach, the global community can enhance the effectiveness of malaria control efforts and work toward the ultimate goal of eradication.